Hey guys, and/or welcome back. So different types of bottles, nipples, things like that are what we're going to talk about in order to determine what's best or how best to feed your baby. So if you have a full-term, healthy, normal baby, whatever nipple, whatever bottle that you have on hand or that has been gifted to you in a baby shower should be fine. Full-term healthy babies usually tend to have no issues when it comes to figuring out how to eat. They're ready. The problems come when you have a premature baby, maybe a baby with Down syndrome, if they have what we call a tongue tie, which is that little piece of skin that is underneath your tongue. If it's further towards the tip of the tongue, that's what we call a tongue tie. It hinders the baby's ability to suck for a longer period of time, and also how strong their suck is. Also, if you have a baby with a cleft palate or a cleft lip. So for the premature babies, typically we'll use a slow flow nipple in the hospital. It has like a yellow ring around it. You can find it in some stores or a specialty type of website, things like that. So it's not only available at the hospital. It just may look a little different when you purchase it at home. We use the slow flow nipples to basically slow down the flow of the milk as they suckle down. So for the premature babies, it's mainly because their mouths are so tiny that they can't hold a large volume of milk. So what happens is when they try to swallow it, some of it ends up being spit out because there's just nowhere else for the milk to go. So we use a slow flow to kind of just slow that milk down a little bit so that they can actually get a chance to suck and swallow properly. We also sometimes will use it for the babies that are extreme sucklers, which is something I've talked about before. And it's just a way to help keep them from choking or aspirating, because those babies tend to just suckle so fast and so hard. You may think that your baby's starving, but it's just that they like to suckle a whole lot. Sometimes we'll also use what's called a Dr. Brown's nipple. There's a lot of moving parts. It means more cleaning. It does mean that you have to be a little bit more prepared because it does take a couple of seconds to put it together for your baby. But those vent inside of the bottle, so it's another way to help slow the milk down so that baby is able to suck and swallow without spitting out half of what they've worked so hard to get. Because remember, like I said, that suckling that your baby has to do is pretty much the same as when we go to the gym. It's a hard workout for them, so they deserve to benefit every suckle of milk that they get instead of having to waste half of it. So for babies with Down syndrome, they have a larger tongue. So again, that is a problem when it comes to suckling. So sometimes we'll use a Dr. Brown's nipple. Also, those nipples tend to be a little bit softer so that they can not use as much force or pressure with each suckle. If your baby has a tongue tie, it's just going to get tired when they have to suckle because it takes a little bit of extra work to move that tongue forward to suckle on that nipple to pull the milk back. And then sometimes it can, I believe it actually gets a little bit sore because that piece is stopping their tongue from moving the way that they would want to be able to suckle. There are some places where the doctors will release the tongue tie, which they'll go in and just kind of snip it so that there's more movement of the tongue back and forth. But sometimes if your baby's eating just fine and it doesn't seem to cause a problem, they'll just leave it as is. Now, if your baby has a cleft palate, we will use a specialty bottle. Usually, I believe it's made by Medela. But basically, the nipple just looks a lot longer than a regular nipple than most people notice. And basically, it is made in a way so that when it's inserted into baby's mouth, it kind of provides a cover for the cleft palate, that hole that's inside their mouth. And it's a little bit longer, so it goes a little bit further back to seal off that whole area, so that when they lift their tongue to suckle, there is some counter resistance so that it can actually get the milk out. So those are all different types of bottles that we would use for different cases and different babies. So I hope you guys learned something, because that lets me know I've done my job, and I will see you guys next week. Bye.